Hello, hello, hello. Hi, everyone. Thank you for taking the time to join us. Last week, we looked into the speaking test of the OET, the generalities involved in the speaking test. And today we want to go in one step further. We want to go into the scoring criteria for the OET speaking test. And so something for you just to keep in mind so that as you go into the test, you know what you are being examined on, so that you'll be able to you keep that at the forefront of your mind, and then you can speak specifically to those criteria. And so, like I said again, what is the aim of the seminar today? What is the aim of this seminar today? We just want you to know what is the examiner looking out for during the entire OET speaking test. And so that's it in summary. That's all that at the end of today, what we want to have in mind, what we want to keep in our mind is what is the examiner looking out for as I'm speaking, as I'm conducting a role play, as you will be acting as if you joined us last week, you will realize that you will be acting as the medical professional, and you will be speaking to an interlocutor. And so it may be a patient, it may be somebody that has come up to you that you're having a conversation with. You want to keep at the back of your mind, what is the examiner looking out for, so that you can implement these in your responses, in the answers that you give during the speaking test. And so we'll jump straight into it today. There are two main criteria. The first is the linguistic criteria, and under that, you have a number of points. The intelligibility of your speech, what's the fluency of your speech, how appropriate is your language for this context, and then finally, what are the resources of grammar and expression that you are implementing as you are speaking. And then under the second broad criteria, we have the clinical communication criteria. And so today we want to dive into these. We want to know these at the back of our hand. We just want to be so familiar with them that as we are speaking during the test, it comes naturally to us, and we'll be able to score high on the OET speaking test. And so we'll jump again into the first set of criteria. And under that, we look at intelligibility. In short, all that this point is seeking to say is that what you are saying, is it being understood? Essentially, what you are speaking, is it being understood? Is it logical? And so for us to understand what you're saying, the pronunciation has to be done properly. The stress in which you put on certain words. And so if you are saying a compound sentence, are you stressing on the right words to indicate the jumping from one idea to the other? Is there an intonation? Is there some sort of rhythm in what you're saying? And so, like I said, in essence, intelligibility, we are saying that what you are saying, are you communicating it properly for it to be understood? There shouldn't be any barrier that is preventing you from communicating effectively. Now, under this criteria, what is known as the L1 accent, that is the mother tongue effect, is evaluated here. By this, we are not saying that necessarily if you're not a native speaker, it means that this is going to go against you. That is not the point at all. This effect, what this is saying essentially is that how we communicate based on our mother tongue, not that because it's different from English, because of the way it's spoken, because of the linguistics they are concerning certain mother tongues. Sometimes when we are communicating in English, it's difficult for it to be understood properly. The pronunciations, the intonations, it makes it difficult. And so all at this point is saying is that we just have to be sure that our pronunciations are very clear, our intonation as clear as possible when we are speaking during the OET speaking test. Again, it's not the fact that you have a mother tongue that's not English, that means that automatically you're going to score low on this criteria. Not at all. It's not at all. All that is being sought is that whatever word is being pronounced, you are pronouncing it very clearly so that the examiner can hear you, can know what you are referring to. And so that's the point that is being examined under intelligibility. The second scoring criteria under speaking that you will be evaluated for is the fluency of what you are saying. In colloquial terms, whatever you are saying should flow. We don't want to be hearing a lot of I think I've forgotten this thing. We want the language to flow as much as possible. There should be very minimal hesitation. When you are hesitating, when you are pausing, it should appear more as a natural pause rather than as though you have forgotten what you are thinking about, as though you are not getting the right word to use. It shouldn't appear as though you are lacking enough vocabulary for you to say clearly what you wish to express. And so under this criteria, you would want to, in colloquial terms, like I said, you want to flow. For you to do that, it's something that will take practice over time. And so at MedCognito OET, for example, as part of the speaking class that we go through for this course, we do practice speaking to each other between the tutor and the student, between other tutors. We do analyze the speech that takes place to find out errors, find out how to correct our errors, our mistakes, and then get better so that we can be able to perform very well during the OET speaking test. And so under fluency, in colloquial terms, you should flow during the OET speaking test with very minimal hesitations, minimal distractions. Under the OET speaking criteria, the third point, what is the third thing that is evaluated for is the appropriateness of the language. What do we mean by appropriateness of the language? You will be speaking to an interlocutor, so it may be a patient most of the time. The question is, what setting are you in? So you are likely within a hospital setting. You may be at an emergency desk and then a patient has been brought to you, emergency desk of a hospital. It may be in a number of scenarios. All this is saying is that the language that you use, the formality of the language that you use, it should match the context that you find yourself in. You are in a consulting room. It's a formal interaction. The tone, the nature of what you are saying, it should match the context that you have been given for the OET speaking test. Now, as we mentioned last week, you are given a role-playing card during the OET speaking test. You would have to read it. It will tell you the context, the setting where you are. It will tell you, it will give you a bit of background in the situation, and then also tell you what you are supposed to talk to the interlocutor, or in most of the times the patient, what you are supposed to talk to that person about. And so by looking at that card, you'll be able to know the context within which you are situated. And then you must use the appropriate language, the formality, the tone that is required for that particular setting. What is also judged under this particular criteria is the technical terms that you use. Now remember, you are a medical professional who will be talking likely to an interlocutor or a patient. So you would have to dumb down the technical terms that you use. It's like if a patient comes into your room, let's say it's a doctor, you have a patient coming in, they haven't gone to medical school like you and are not as smart as you, definitely. They may not be as smart as you, let me put it that way. And so you would have to break down medical terms into layman terms for that person. And so during the speaking test, you will be judged on your ability to relay complex technical terms in simple layman terms for the patient to understand. The fourth criteria that you will be judged under will be your grammar and expression. And so over here, we are looking, the examiner is looking for the fact that you have a rich array of grammar and vocabulary, which you are using correctly, accurately. You have to demonstrate a deep understanding of the English language by the grammar and the vocabulary that you choose to use in your expression. If you are using an idiomatic expression, it rained cats and dogs, something like that. You would have to use it correctly in the right context. You would have to use it appropriately, not in a wrong manner. And so this is something that you are going to be evaluated on. And so for OET, in order to reach this goal, for example, we do hold special classes during the OET session where we go through grammar and vocabulary, just to be sure that our students are prepared, they are well-resourced to be able to answer meet this criteria under the speaking test. Vocabulary, you will be evaluated for your vocabulary. It's applied correctly, simply, facilitating thoughtful responses to the patient inquiries. So the patient is asking you questions seeking to understand something during the speaking interaction. You are using vocabulary that's easy for the patient to understand, so that the patient can relate to what you are communicating to them. The final criteria for which you are evaluated under for the OET speaking test is what we call the clinical communication criteria. Now, under this criteria, essentially what you are being evaluated for is if you are acting as a medical professional. And so a few things that are being looked at during this session. One, relationship building. So are you initiating the interaction appropriately? Are you the patient or the interlocutor? Are you doing proper introductions? Are you demonstrating being attentive and having a respectful attitude? These are things that will be expected of a medical professional in a clinical setting. And so you are being evaluated for all of these. Your understanding and incorporating the patient's perspective. And so are you eliciting and exploring the patient's ideas, their concerns, their expectations? Are you picking up cues of the patient? What is the expression on the patient's face? Are they showing that they have pain? Are you picking these up and asking appropriate questions concerning it? Are you providing structure? That is, are you asking the questions logically, following the questions that are on your role play card? You are flowing it and asking questions logically, such that it's providing structure. You are providing signposts. You are providing things that is making it easy for the patient or the interlocutor to follow you, to follow what you are saying whilst you are in that setting. Another thing that you are being evaluated for under the clinical communication criteria, are you gathering information properly? So for example, are you asking open-ended questions rather than asking, are you feeling hot? Are you feeling cold? You may probably, you might be better off maybe asking, how are you feeling today? So that you allow the person to express themselves very clearly, so that whatever information that you require, you need to make the diagnosis, you're able to get that. And so you are being evaluated for these. And finally, information given. And so during your interaction with the patients, are you establishing initially what the patient already knows? Are you checking whether the patient has understood the information? Are you confirming with them? Is it clear? Do you understand? Are you getting what I'm saying? You are being evaluated for all of these things. And so under the OET speaking criteria, whilst you are going through it, keep these things in mind. This is what you are going to be scored on. And so you keep these things in mind and you implement them during the speaking session. The key point, like I said, the key point in all of this is that you keep in mind that you are adhering to the linguistic and the clinical communication criteria, the two main criteria, which is being evaluated, under which you have sub-criteria, which we just went through. Are you actually adhering to them during the speaking test? It's what you should keep at the forefront of your mind, because this is what you are being marked on. This is what you are being evaluated on. And so you ensure that you are keeping to the linguistic criteria, you are adhering to the clinical communication criteria, you are placed yourself in the role of a medical professional that is dealing with a patient. You are behaving as well as though you behave as how you would behave if that were real. You are being evaluated on that. And so that is what you are paying attention to. In essence, this is the OET speaking criteria. This is what you are evaluated on.